Hello and welcome to another episode of the Young Tongues podcast. My name is Barbara Fountain and I'm the founder and CEO of the Young Tongues, a peer-to-peer support group. And I'm here today with a very special guest. Please all join me in welcoming Chaya Emmanuel with me today. Chaya, it's lovely to have you. Today's going to be a bit different because we either have an expert on or we have a patient on, but actually you are the partner of a patient, and I thought it was a really valuable point of view of what it's like for a carer and a family member to go through this journey of having a loved one being diagnosed with tongue cancer. I just want to give a little bit of a heads up for anyone listening. Your husband, Dobie, who I'm sure we'll get to know a lot better through this conversation, has sadly passed away, and I'm sure we'll be talking about that aspect and grief as well. So just for anyone listening, if today's not the day, that's fine. You can come back to this episode at any time. But for now, Chaya, welcome. It's lovely to meet you.
Thank you. I'm glad to be here.
So Chaya, I always like to just start at the beginning, because we've never met. Today's the first time. I don't know that much about you. In what part of your life were you and Dobie when this journey began?
Yes. So we had been married for a few years. We were living in Chicago. I'm originally from Massachusetts. And Dobie was from Chicago and his family was there. So we were there. We had our son was about 20 months at the time that he was diagnosed. And we were just living life. Dobie was a few years into a really great career and doing really well in that aspect. And I was also working. I am still working, and we were just taking care of our son. And at that point we had also, which will factor into our story, we were ready to have another child. We wanted to grow our family, and we were living. I would say we were doing really well. So our story. So the cancer part of our story starts almost exactly 2 years ago, in July of 2024. Dobie had he had a canker in his tongue, and I think that's how a lot of these start.
Yes.
And he, I mean, it wasn't like anything to be alarmed at. I don't know. I just tongue cancer never crossed my mind, and I don't think it crossed his mind. And he went to his dentist first. He said, "Oh, you should maybe go to an oral surgeon." He was going to his primary care provider anyway around that time, so he went there, and he said, "Oh, it looks maybe like a bite. Here's like a magic mouthwash. If that doesn't work, then we can refer you to an ENT." He ended up getting referred to an ENT, who also wasn't sure if it. I think my husband had protected me and not told me that the worst case scenario, because I think that in the appointment they did say worst case scenario it could be cancer. And I don't think he had told, and I don't remember him telling that to me specifically. And then after a couple of weeks, it wasn't going away for the ENT. He had gone there for a few times. They said, "Let's do a biopsy." And he had a biopsy on a Wednesday. I think it was early August. And on Friday, he got a phone call that it came back as cancerous. And I guess I was naive and didn't realize that biopsy would pretty much lead to cancer a lot where it could.
Well, it isn't always, and I was in the complete same position as you. They said we're doing a biopsy. Cancer didn't even cross my mind. So yeah, it's not a given. So don't feel like you missed something there. But yeah,
and also Dobie was 29 at the time, so really young. And honestly, until a few days later, when we went to a different surgeon together, I thought they were gonna call up and say, "Oh, something happened with the blood work or the lab, and it was wrong." I really, really thought that. We're also Hasidic Jews, and so within the religious community, there is a large referral network, and there's people who have connections to doctors and things. And so my husband, we got the call on Friday afternoon. On Sunday, we called somebody from a referral network in Chicago, and he got us an appointment with who he said is a top surgeon in the Midwest area, at a hospital in Chicago, and at Rush University, which is affiliated with Texas MD Anderson. And we had an appointment for a few days later that week with the surgeon. So we met with the surgeon. She said, she said, we can't stage it yet. Obviously, we'll do surgery. It was non-HPV cancer. My husband was not a smoker, not a drinker, no risk factors, like really, really shocking. And the general consensus from the doctors at that point was, we're going to take the tumor out. She didn't think that he would need grafting at that point, but she said we won't know until we go in there. But she didn't think grafting was necessary. And they didn't think he would need chemo, just radiation. And they also did a sentinel lymph node biopsy during the surgery, where they removed like the largest lymph nodes in his neck and tested those. And they said, based on that lab testing, we'll either add in chemo or not.
Mm-hmm. Absolutely. How do you? I'm just going to slow you down a little bit.
Okay.
Before we go for, so for you as a partner, how did you feel about it at that point? Like, because I assume you're trying to support Dobie. Dobie's trying to protect you.
Mm-hmm.
I mean, there's just like a whole onslaught of information. How do you cope? You've got a young child.
Yeah, I think I should have done more for myself and like taking off more time at work or like that. I did not. I was like, we just need to keep going. And both of us, I think, were under that. Like he was still working. We're like, we need to just work. This is just a blip in the road. We're going to get through this. He's going to have surgery, radiation, and everything will be fine. We're going to keep taking care of our son. We're just going to, and I think that was our perspective.
Yeah. It's a coping mechanism
yes.
as well. You know?
Yeah.
Not everyone, like I needed time off because I couldn't function, but for others, but then actually there came a point where I was like, well, I need to go and be productive again and have some normality. Mm-hmm. So
yeah, and
Dobie
was always a fix-it personality. Mm-hmm. Like just did what kind of like the type of person just does what they need to do and moves on. Like he didn't dwell on things in the past or like have like a lot of regrets. Like just even not even cancer related, just in general. He was very like go with the flow and like a lot of friends and like a happy person. So I think like from that perspective, he was like fix it. We're gonna fix it. I'm doing what I need to do, and we're gonna move on. And that's also just who he was. And I think that also and he did do things that to protect me in a way from things. And he did have certain people that he talked to a little bit deep, like on like a little bit more than is like showing his fears to me, especially at that point. But yeah.
Yeah, absolutely. So I think because you said your child would have been 22 months at the time.
He was 20. Yeah, he was around 20 months.
20. So too young to really explain what's happening to Daddy. So I guess surgery is the biggest change because there's some physical changes and
yeah. So we said like he has a boo-boo. Just be careful. But other than that, like I don't think my son. I don't think he really realized that he had surgery. Also, Dobie's he had a really good recovery from surgery. He came home within like a couple days. He didn't have the trach. Like he didn't end up needing any grafting. They were able to just like remove with good margins and close the gap that way. And he was eating was a little slower, but he was eating within like a couple weeks. And his speech in general after post-surgery, I mean, I think his speech was, the speech pathologist said it was probably around like 95% and probably like to previous, and it wouldn't, like that was probably what it was going to be. But for the most part, like you really couldn't tell at that point that something major was going on.
Oh, it's amazing to hear that he had such a great recovery. But I'm taking the sentinel biopsy showed that he definitely needs radiation, or Or not
No.
really?
So actually, the sentinel lymph node biopsy showed no cancer in his neck. And
Wow.
yeah, and so because of that, he only had radiation on his tongue.
Okay.
And he did not have any chemo. And I think also as a I think I also didn't understand at that point like what chemo and radiation meant. Like you see in the movies or in books, and I think in hindsight, like it's a lot and it's very scary, but I don't think it's if it. And I think that this is where the doctors also they want to they have this fine line between helping the person versus doing too much and causing other long-term side effects. So and there's also all different types of chemos. There's not just one type. So and I didn't really know that at the time. But yeah,
and even radiation, there's different types of radiation, the frequency, like, and where they aim it if they go for a bigger field. So yeah, there's a lot of nuances across both of those treatment paths.
So he had 6 weeks of daily radiation. He worked throughout. He would go really early in the morning because it was to get to the hospital. It was like you have to like go through like downtown and traffic areas in Chicago. So he would go early in the morning and then go straight to work from there. And he was doing like well. I mean, he did have like the side effects of radiation. He was tired. He had like the mouth sores. He lost his like sense of I think taste. And like in the last week and the week after were the worst parts of radiation. But overall, he was doing well through it, like considering. And I know that like with radiation they do like scanning every day and they're looking at it, and there were no like red flag. And even and then on I've heard important on a personal note. So number one, like pretty soon after surgery, we found out I was pregnant.
Okay. Yeah, very impersonal, very important notes.
Yeah, and that and that is that was for as on my perspective a big part of our journey. So we found out I was pregnant, and that thank God that pregnancy was going well. And I also thank God I don't have the terrible first trimesters. So like nauseous here and there, but for the most part, like I was doing most of the child care with my son, dropping him up, doing all that stuff. And then the last week of Dobie's radiation, we also made an offer on a house that had always been Dobie really for a couple years. By then, he had wanted to buy a house, and I was like, I'm not ready. It's a lot of money. But at that point, we were doing better, and I thought like like this is definitely I don't have to be. And I think that this has cancer has changed my perspective in certain things of not worry. And I'm a worrier. I was the more frugal one, the one who took care of the finances. But I think like if we were able to do it, like let's do it. So we put an offer in a house that was accepted, and that also meant that like Dobie he had something. He was really happy about it. He had something to focus on as he was recovering.
Yeah.
And that was
it's funny, minus the pregnancy, but we also bought a house just before surgery, and then did the move after surgery. And I was like,
so that
everyone's like, why are you doing the most stressful things in life?
No, that was to clear. So the house was after radiation. Yeah, but still like within everything. But that's also I think that's also the way he was, and that it was like I don't need to like stress. Like I'm gonna get better. Like I don't like the doctor has really good prognosis. We don't have to worry. Like we're just gonna keep living life. And that's really who he was.
At that point, did they mention staging at all? Like
yes.
After the
yeah. So I think it was staged at 3T2, if I remember correctly. And that was more just based on the size. Because it hadn't spread. At that point, it had not spread anywhere. They didn't find cancer anywhere else, just in his tongue. But it was like I think the sizing of what they removed was just a little bit larger, and so it put it into the stage 3 category. So and that was like in January we moved. My husband turned 30. We had like a big celebration because in our minds he was recovered. The doctors were really happy with what had been going on and his progress and how he tolerated radiation and getting back into normal life. And I was by that point probably 5 or 6 months pregnant. And we were like, hey, we're focusing on the pregnancy. I remember telling people, like, I just want calm now. Like, we moved, we finished cancer. Like, now I just need calm for myself. And that was in like January and February. And then, so now we're in 2025. And then he had his 3-month scan. I know he had really wanted to do 2-month scans, but they said no because like the radiation you have to let the area recover from the radiation because otherwise. And so he had his 3-month scans, I think, in the beginning of February. And at first we were told, oh, it was fine, like everything was good. And then a couple weeks later, he came home one day and like his neck was like at a really awkward angle. And I was like, Dobie, what? Like, you're scaring me. Like, what's going on? So a few days before, they had called him and said, we reviewed the CAT scan. You need to come in. We think we see something on your neck. So he didn't tell me. He went in for the biopsy. He wasn't going to tell me until he got the results, but it was too obvious just from like the way he was like holding his neck. And so, yeah, that was really hard because like we thought he was done. And we thought like we had followed all the guidelines and the standard of care, and they had tracked his lymph nodes. They didn't do a full neck dissection, but they had checked them. And unfortunately, the surgeon told us at our next appointment that the sentinel lymph node biopsy can have I think it's a less than 5% chance of being wrong. And I feel like I was like, wow, statistics are not on our side. My husband, he shouldn't have, like, I think less than 5%. He had a less than 5% chance of getting this type of cancer to begin with no risk factors and his age and not the and stuff. And then the less than 5%, the sentinel lymph node biopsy error, or I don't know if it just didn't flag. It didn't flag in the lymph nodes.
It didn't flag, or it might have just not flagged at the time. We do have that happen in the community. And I think it's a really good point that you made. Like, it sounds like you had the best of care, and it sounds like you did everything right, and still.
Yeah, and Dobie was very evidence-based, and I'm also, we listen to the doctors who are experts. We're very much, we're going to follow evidence-based medicine, believe it, and unfortunately, it didn't work for us. So at that point, he had surgery scheduled for, I think it was the 2nd or 3rd week of March, 2nd week.
So it was resectable. So they found the tumor, and actually they were able to move the
So they said we're going to do a full neck dissection. They did it on both sides, even though the tumor was only on the left side, the same side that his tongue cancer was on. They wanted to just make sure that it hadn't spread across. So they did the full neck dissection. That one he was in the hospital for almost a week. But again, he was eating food a day or two later. I remember like picking up food from him like on my way to see him in the hospital. So he was eating, he was in good spirits, but he knew like, okay, I have to like take off a couple weeks to recover from and again
a couple of weeks. He's hard as nails, isn't he?
Yeah, and I think, and if I remember correctly, I think that the surgeon did say that they got clean margins. They were able to remove it, I think, if I remember. And so that was in March, and then we knew he was going to be doing, so the plan at that point after surgery was to do 6 weeks of radiation just on his neck, along with a weekly chemo that would, I think it was cisplatin, that would help make the radiation like even more stronger. And so in between, we it was Passover, and we came to Massachusetts and my parents, city of my family, for Passover. And again, I was 8 months pregnant by then. And I remember during that time, he definitely needed like to ice his shoulder or his and stuff, but I don't remember it being like he wasn't in like daily pain, and he was tolerating it. And yeah, he was on like the regular like medication post surgery and stuff, but it wasn't in like he was still functioning and able to function. And we came back to Chicago. That was end of April. In May, I would just say things kind of just like went downhill in May. He started radiation, and a couple days after, he was in tons of pain in his neck still. And so they did scans really quickly, and they said, okay, we need to regroup. We need to like reevaluate. And I guess there was still cancer there. That was growing. So they decided to put pause on the radiation, and they were going to do switch to different chemo. I don't remember carboplatin. I don't remember all the names, yes. But the two chemos, one immunotherapy. I'm like, I don't remember if it was a 2-week or a 3-week cycle. And so and that was hard. It was really hard. He stopped. He at that point, and it was May. He really wasn't able to work. He was home. He was in and out of the hospital a few times. Just because he would be in like a lot of pain, and so he would want to go to the hospital and to make sure things were okay. And I think also in our what people who had cancer were telling us, like, oh, like this is the effects of the chemo. This means the chemo is working. Like if you're feeling so horrible. And he also was at that point he was having trouble eating. And he wasn't keeping. I don't remember if I don't think he was vomiting that much, but he just wasn't able to eat. Like his nausea, and also just like his neck and swallowing. So he was really, really out of it. He was actually in the hospital for a few days, about 2 weeks before I gave birth, and everyone knew like, oh, his wife is like due, and we need to get him out. We need to get him well enough to be discharged. And then he came home. At that point, I started my maternity leave a little early. And that's one thing I have to say, like my employers have been great throughout this. I have done maternity leave and caregiver time, and my husband's employers also were really supportive and always checking on us and still check on me even now. And
which is lovely. It's so lovely to have that community around you too.
Yeah. And also, and being in the religious community in Chicago, there's a large religious community, and they were also really supportive and with food and things like that. And so we planned my an induction when I was about 39 weeks, just so he could be there because like around chemo. And my doctor was also amazing, and like, yeah, he can totally be there. That's not a problem. So I was induced on May 25th. It was Memorial Day weekend, actually, on a Sunday. And and Dobie was there the whole time. He wasn't really able to do much, but he was just sitting there in a chair, and the nurse would forget us ice if he when he needed more ice for his back. And then I gave birth to a baby girl.
Congratulations.
Thank you. And he went home. And then 2 days later on Tuesday, he went in for chemo to his and his hospital and my hospital were different. Like it's there's a large medical industry in Chicago. And so he went for chemo, and I don't know if it was him or like a discussion with him and the doctor, and they said, he's like, I need a G-tube. I am not eating, and this will help give me strength. So he was admitted. So the day I was discharged and I went home, he was actually admitted to the hospital for a G-tube. And
oh God, Chaya, I'm thinking about your hormones as well. You've just given birth. You probably don't want anything more than spend this precious those moments with your husband there as well. So God, yes. Okay.
Yeah, so that was really hard being like immediately postpartum and having two little kids who and my family was there in and out to help. They all like took rotation. My husband's family was at this point they were really supportive, taking off work and bringing him to and from appointments and spending time with him and keeping and staying there with him because I couldn't be there with him. And so he got a G tube in, and I think that was something that he was so scared of getting earlier, and I think in hindsight, like we shouldn't have been, and we talked about this like when he was like doing a little better, like the G tube helped him, and I think that and the doctors were like, and a goal of like the speech pathologist and nutrition was let's avoid the G tube, but in reality, like it did help. And it really did help him, like able to take medicine and just to get some strength and make sure he's getting like nutrition and nutrients. So at that point to say that week also, his doctor kind of said the current chemo plan is not working for you. You need to find a clinical trial. And the hospital did not have any. And this is something that so I said earlier, it's affiliated with Texas MD Anderson, but you don't actually, you still have, if you want to be part of like Anderson clinical trials and stuff, you still have to go there separately. So ended up I had the baby Sunday. So Thursday I was in between new doctor appointments for my daughter, lactation consultant was coming to my house, and we were told, okay, we need something else needs to happen. So I called back that referral organization and spoke with the rabbi, and he was amazing. He helped us a lot even later on, and he got in touch with another doctor at University of Chicago, and who does select clinical trials in head and neck cancer, and we got an appointment for a few days later, and that was also a stress because it was like because then they told me, your husband's in the hospital right now. Oh, he needs to be discharged a day before. He needs to be home at least a day before your appointment's here, because for insurance purposes, you can't bill inpatient and outpatient for the same day.
Oh God! So then it comes to the all admin of things of why don't you just help and make life a bit easier instead of making it more complicated?
And with the G tube, like they have to make sure it's working and they have to make sure that he can tolerate it and all that stuff. And thankfully he was discharged the day before, but even with that discharge, some pieces of equipment were missing that we needed for the G tube, and it was a lot. I was 10 days postpartum, and at this point, and like his family was taking care of him and his needs and making sure he was good, and my family was taking care of me and making sure, like me being postpartum, that like I was doing okay. It's just. Which was good. It was good like that. And so we went to University of Chicago. We met with their doctor team and their oncologist. And he had clinical trials available for that my husband could be a good candidate for. And there were even some hiccups with that. And he ended up getting into a clinical trial for petosemtamab, which is an EFGR inhibitor. I don't understand all of the science behind it, but I would say
none of us do, so don't worry.
I say even with the clinical trial, that's like you have it. So I'd say because I was talking to my friend, because there was another one that we had actually wanted him to be in, and he didn't get accepted because some blood clotting things, and it was like you have to be sick enough where standard of care isn't working for you, and you need a clinical trial is the right option, but you can't be too sick that you have to have your blood work has to be good and all of this stuff, but you can't be too sick that you can't tolerate it. And also the wait time between his last chemo treatment till he could start the clinical trial. And I understand all the regulations and there's a lot behind that goes into it, obviously, but from a patient and perspective, it is frustrating. And I know they were really concerned that the cancer would be growing during that month that he had off from treatment. Oh, and I forgot one more thing. While he was in the hospital for his G-tube, he also got 5 days of a higher dose radiation directly to his neck.
Okay.
And that helped stabilize him a lot, I would say. And he even, a few weeks later, like in between, in that waiting period for the clinical trial, he and his brothers went to Texas, to Houston, just to get like another opinion at MD Anderson, and just to like kind of get into their system as well and make sure that all aspects are being looked at. And they said, and they had clinical trials too, and they also said, hey, look, like the clinical trial you have, the option there is a really good option, and also something else, like and obviously if Texas had a better option, or like if there were no option in Chicago, Texas would be an option, but it is better like quality of life to stay near home and be with your family, especially with a new baby.
Yeah, absolutely. And Chicago and Texas are not necessarily near each other either.
Right. Yeah. It was like a 3-hour flight when they went. Yeah. And then at that point, so like around when he started that clinical trial, he was eating, and he was still doing G-tube like feedings and all his medicine through the G-tube. But yeah, he was eating. He was like doing okay relative for what he was going through. And so he started that at the end of June, I think, what's his like first appointment. And then he also, during that, after his first trial infusion, I think it was right then, he got a stent placed in his neck, because something they were worried about was the location was on his artery.
Artery, yeah.
Yeah, and so they were a little concerned about an artery blowout, so he got a stent placed there, and that went well. And he was, at this point he wasn't working, and then in August he actually started working a few days a week, part-time, and he was driving again, like locally a little bit, which I think
that's just incredible, isn't it? And I assume he was doing that because it was helping him.
Yes.
Having the routine.
Yeah. And also like being able, like not being dependent on people to go to like the grocery store. And like that's something he really valued, his independence. And like even like when we were together always, he was always driving. Like I never drove until I had to. I never drove when it was the two of us in the car. And like that was like he's like, no, I'm driving. Like that's fine. Like even like on a long road trip. And so him having his independence and being able to feel somewhat productive was definitely really good for his mental health and so on.
Did that also give him a bit of time to bond with his new daughter? And
yeah, I would say like in the beginning when she was born, I would say he was really scared. Like he didn't hold her a lot. He was really like nervous about like his arm strength or just not be able to, like if he had to like cough or something, just not like he was nervous about that. And later on he did feel a little more comfortable. Like I would leave him at, like if I had to run an errand, I would like leave Ben at home, just the two of them, like for half an hour or whatever. I will say, and with my son, he was really hands-on. Like, he woke up every night, like we switched off. So it wasn't like he was very hands-on with our son, and like feeding him and giving bottles and stuff. And so, it's not like, and so he wanted to be involved with our daughter. He just couldn't at that point.
Yeah, and to be fair, they're tiny.
Yeah.
I mean, and I've got a bit of a weak hand, but when my nephew got born, I was a bit like, and I was fully functioning at the time. I was like, well, I don't want to break it. So,
sure. Yeah.
Totally understand.
Yeah. And I think things were going good, and we were hopeful. And I think I think like looking back, like I didn't realize I knew how bad it was, but I think also we chose to just focus on what we could do. And I think that was also just something that he did, and that caused me to do that. Like I I don't know if that is my innate personality to do that, but that was definitely his.
Yeah, and I was going to ask in terms of what the communications was towards you, in terms how explicit clinicians were in terms of what to expect or what the likely outcomes would be, or if it was actually just easier, you know what, we're just going to focus on one day at the time and keep holding on to hope.
Yeah, so I don't think the term terminal was ever used for him, even then. I think it was, and I do know later on, like the oncologist told us, like, I don't think, like, I was scared he said I was scared he wasn't going to make it till the clinical trial because of how bad he looked that day, that initial appointment. But I don't, and I do remember, like, being told, like, when he got referred to palliative doctors, oh, this is for pain management. It's not necessarily, it doesn't mean that it's palliative. Like
End of life.
hospice. Yeah.
Yes.
End of life. So, and I don't know if that was also, I don't know if maybe they were mirroring him and what we were saying. I know I did ask one of his doctors privately, and I don't remember the exact answer, but it was like, look, this is what we hope for, and like we can't, like, we can only do our best type thing. But I didn't think it would be so fast, definitely. I thought he would have more time.
Because I was going to say, because there's also this whole aspect of enjoying the moment that you still have together, but also mentally preparing yourself for what's about to come. Yes, I don't know how you felt about it. I don't think anyone's ever ready, let's be honest.
Yeah, I think that, and I know and we didn't do any, like, legacy project. And I have, like, some feelings of, I don't know, regret, but just, like, feelings like, oh, I didn't do that for my kids. And I think, and I do know, and I never brought it up with him, but I do know other people did. And I think when they brought it up, because they told me later on, he said no, like, he was not interested. And I think at the point where it was like, okay, this is really soon, I think it was by then it was just, he wasn't in a position anyway at that point.
It's too late.
Yeah.
And don't apologize. It's absolutely fine. But I do think this is a really important message, because it is, you're not alone. It is something that I, on the outside, that come across people who've lost young tongues. It's a conversation I've had a few times with loved ones of going, it just went too fast. And by the time their loved one was mentally ready to do the legacy work, it was too late, because the functions just declined so quickly. So if we want to, if you feel comfortable, we can talk about it, but we don't have to, about what happened.
Yeah.
But months or weeks after.
Yeah. So so things were going good. His scans were showing really good shrinkage, but they were showing, and he was getting some brain on the MRIs also. It was showing a little bit of movement into his skull, the back of his skull. And Dobie was nervous about that. He did bring that out to the doctors, and they did say, like, we're going to keep watching it, but overall the shrinkage is good. Like, overall there is shrinkage there. And so now we're getting into, about in October at one point his G-tube fell out, and by then he wasn't even using it. And so we just and he went to the hospital, got it checked, but we left it out. Yeah. Because he wasn't using it. He was taking his medicine orally, and he was eating normal. And then in November, I had my birthday. So I turned 30, and right after that, I feel like he kind of, like, held out till my birthday and our son's birthday, which was a few weeks later. Right after that, he started feeling nauseous again. He had to skip a week of treatment. He went in for the next week for a makeup, and they said the medicine isn't working anymore. and they were going to switch him to, I don't remember the names of the medication. Like that was just, also because I was so postpartum when all this started, like the names of the medications were just not something that I focused on.
And it's fine. And to be honest with you, we can blame postpartum, but also without postpartum, they always make those names so complicated and long. And they all sound alike as well, which is really not helpful. So no, completely understand.
So he started on, it was like a 5-day chemo infusion. So the first one he had to do in the hospital because he didn't have a port in yet, and the plan was that he would get he got a port during that time also, and the plan was for him to be able to do it at home later on, and the next cycle. And then that week, so in our culture, we wait to cut a little boy's hair until their 3rd birthday. So we had a big party, and we had that planned for our son because he was turning 3. This was Thanksgiving weekend. And so we had to change the date to 2 days later to make sure so that he would be home. And he wasn't he was there for maybe half an hour or so at the party, and then went upstairs. It was in our house. And just because he couldn't tolerate it, but he was there, which I think was really important for us and for my son now. And so also during this time, they decided, let's do radiation to his skull, to the back of his skull. Because it was, the cancer was also pressing on nerves that impacted his eyes, and his vision was like getting blurry and stuff. And so they kind of were, and there were some other issues also, like other side effects. They said, let's do some, and this is something that also, I don't say it worked out, but it was, they really were trying to do radiation in a way that was, they were able to do it because radiation is so localized to like that specific area, if that makes sense. I don't know.
Okay. And they were making it for him to have better quality of life.
Yeah.
For that time, yes. We
So those 5 days of radiation were excruciating for him. He could barely get out of bed. He wasn't eating, and he said, I want another G-tube. I want to get that back in. So we planned for that last day of radiation to have a G-tube placement, and he had the procedure. During the procedure, after they tested it, he was like, I'm nauseous, and he vomited and aspirated into his lung and or into his lungs, and then his heart stopped. They were able to resuscitate him, but he was in a coma for 3 weeks until he died on December 31st. And he was transferred to hospice care. He was transferred to like a nursing home that could take care of like the respiratory needs. And I will say, and that was also just hard as a caregiver, not just to see my husband like that, but also my husband his job was a nursing home administrator. And so to see him like on the other end, but his employers, as I said, and he has family and friends in the industry, and his employers, and they were really helpful in getting us a place and helping us find a spot, and also just in general throughout the journey because they have connections with medical equipment providers and so on. We were able to get certain things. And he died. It was right after his 31st birthday.
Oh, bless him. Right. I'm crying now. I'm pretty sure everyone listening will be. Oh dear, Dobie. So those last 3 weeks when he was in a coma, did you feel almost, and I don't want to say this the wrong way, but I would almost feel like a sense of relief because he didn't have to be fully conscious for what was happening?
Yes,
or was it more like,
it was really hard? Yeah, it was really hard. I think also because he was, I guess like I had thought when they said, oh, we were able to resuscitate him, like that he would be somewhat aware, but he wasn't at all, which in a way was good because I think like there's no dignity in it. In the hospital, in the type of hospice care that he was at, like he wasn't able to be home, but But on the other hand, he didn't know. So yes, that is some like relief. Yeah, and we did not bring my kid. We consulted with professional. I didn't want to bring them anyway, but we were told not to. And that also, I think there's like very little resources out there. I am part of another, I don't know if you've heard of them. They're a U.S. group, Bright Spot Network, specifically for parents who have cancer and have young children.
Great shout out. Thank you. Yes.
Yeah, so there are other people who have young kids as well. And there's a group specifically for caregivers, and now there also is a bereavement group. But in general, there's really, like, this is like a really lonely space to be in.
Yeah. So, were you able to spend a bit of time with him in hospice?
Yes. So
did that help you personally to grasp what was happening?
I don't think so. I don't think it helped me. I did. I went every day that he was in hospice. I went there. Like every day I was with him. I was with him at the end. I wasn't in the room because I was actually pumping right with him. And then I came back but his brothers were there. We knew it with like the hospice nurses told us he's transitioning. So we knew it was happening either that day or within a few days. I think like, and I definitely remember like telling, like, I didn't want him to be in hospice for a long time, and like no one can tell you how long it's going to be. So in a way there is some relief, I guess, that it was. And also some things that like, for things that Dobie and I talked about, even like before cancer, just like general discussions that we've had about people and situations, I know that is something that he would have also felt relief at.
Yeah. So, continuing down that timeline, and I find this part quite interesting, because in terms of the work that we do at Young Tongues, because we have the supporters group, and it's kind of there as a space, but we don't really do a lot of activity in there to support. It's more for carers to support each other in the same way we have the peer support for patients. And quite often it's when someone passes is the first time I have a contact with a carer, a partner, family member. And I always feel like I do my very best to express empathy and to try to find the right words, but it's so difficult. And I always wondered, fortunately not having to go through that kind of loss myself, what is it like? And maybe more importantly, how can people listening to this learn from your experience to support people around them who might be going through something similar?
Yeah, it's a good question. I think so. Number one, going through it, I will say that, like from the medical perspective, and about a year ago, so like while he was in, he started seeing with a therapist, an oncology therapist with, and I went with him to like some of the appointments, and he wanted me to be there, and he invited, and I think that was helpful for us, because I think also within, like when you're going through it, like he was so focused. There were times where, and we talked about this, and I think I can share this, that there were times that he was just so focused on himself, and like, and in the moment I would be frustrated, because also I was the month postpartum, but and we talked about it, and I felt like I didn't realize at the time, but like you were so focused on just surviving the next hour until you could take your pain medication again. Like you were in so much pain that like, of course you couldn't ask me how I was doing. So I think in going through it, that was helpful. And I think we had a really good relationship before all this, which was also really which also helped a lot. And then and then going through it and post everything, how can people be more supportive or support like a friend or someone who's going through it, I think it's a lot of just checking in on people. Like I have some friends who call me and I won't always answer the phone, but they don't stop. Like they'll still call me the next week. Or just messaging me saying, how are you? Like, how are you doing is a horrible question to ask.
It's the worst question,
it's never,
but
and the other worst thing you can say to someone is let me know how I can help. Because now you're putting that mental like onus on me, and I'm already like drowning. That now I have to come up with ways to make you feel a little better. But
no, very true.
I think this is probably true also for the patient themselves.
Yeah.
But I think just reaching out and just kind of like and being ready to be uncomfortable, because I'm uncomfortable obviously in where I am right now, and it's hard. There's some days that it's really hard, and I mean right now I'm living with my parents. They're amazing. They do so much for me and for my kids and take care of us, but it's still really hard, and so like I'm in this perpetual uncomfortable state, and I think some people are just like they're so scared of saying the wrong thing or being awkward and don't want to have that. They don't want to sit with that uncomfortability. That I think like it's okay if you do say like it's okay if you mess up a little bit and then just like move on, but keep reaching out. I think also something else is that I've heard some people say, and I don't know if any of my friends listen to this, and I don't want them to feel like I'm calling them out, but I have heard some people say, because like we left Chicago, we left our community because I needed my parents' support, and I've heard people say like, oh, like we've been talking about Dobie a lot, like he's always talked about. I'm like, that's really nice, but I don't know that because I'm not there, and you don't tell me until one person tells me 5 months later. And so I think if you remember him, like if you remember the person, like the loved one who's no longer here, let them know that you're let the person who's grieving know that you're thinking about them. And when I see those messages, like when people do let me know, I do sometimes tear up, or I won't respond for a day or two because like I need to make sure I'm in the right space.
In the moment.
Yeah, but I still really do appreciate those messages. I think when people, because for me, I'm like, am I the only one who's missing him?
I never met Dobie, but I miss him just by you recalling his story. So
Thank you.
I think the thing that really resonates, and what I'm kind of reading between the lines, is that the worst thing is silence.
Yeah. Yes, and I've had friends who I lost touch with for 5 or 10 years, who have reached out to me, and we've restarted, and we've reconnected, and on like a ongoing basis, and that's really, really nice. That's really special to me. But so I think, and I see people will write like, I don't know if I should say anything. Say something, even if you haven't spoken to the person in 5 years, because it makes them, and it hurts when I see those messages, but it's a hurt that makes me it makes me feel like people are thinking about me, and it makes I don't know if people are thinking about me unless they tell me, because I can't read their minds.
Absolutely. And I think also as you go through time, so we're now 7 months.
Yes,
basically. So you're still within that first year, which, you know, I can't even imagine all the changes to your life, having moved, children. On one way, everything's coming at you at really high speed, but on the other hand, your life has changed so much. And I can only imagine that as you're going through the anniversaries and the reminders, we started off this conversation by saying July is when it all happened 2 years ago. So I can imagine that will take time to grow around it. we just talked about grief on the podcast the other week, and we said the grief never gets smaller, but we tend to get bigger and grow around it. But one of the things I find really important, and also from a patient perspective, keep the invites coming.
Yes.
Even if we don't show up for many of them, or we have to cancel short notice. I think grief and going through treatment and healing from treatment is a different type of grief, but that's what it has in common. Because if the invitations stop, that's like the hardest part.
Yeah, I know. I 100% agree. Agree with that. Yeah.
Chaya, just before we close, for anyone listening or who's now listened to this podcast who has a loved one who's might be quite early on in their diagnosis or going through treatment, what is the thing that you've learned about your own experience that you would like to give on their way to them? What are the things that they could maybe do to look after themselves a bit as well?
Yeah. I think advocating for themselves and for their for the patient. I think like one thing that we didn't realize is like with the neck dissection, there like the lymphedema aspect and not getting referred to physical therapy right away. I think that there's things that could be that we could have done better for his quality of life. I don't think that they would have changed the outcome necessarily. And one thing I will say soon after he was in a coma, his oncologist came by to talk to us, and he did say that Dobie's cancer was one of the most aggressive he'd ever seen. And in a way, in like a weird way, that's almost like a comfort that like we did all we could. And you're going to do, and I think that is also something of like, you can't ask and I obviously do ask myself, what if, but as like the caregiver, you also just have to, you have to try and not ask yourself, what if we do, what if, and just try and advocate for the person you're supporting, and make sure like quality of life is important. And yeah, I hope that answers your question.
Yeah, absolutely.
And taking care of myself, I don't know. That's still something I'm figuring out. Yeah.
Yep, totally understand. And I hope that after this, I can connect you with some other people in the same situation as you, which I think would be great for you guys to connect. But Chaya, I just want to say thank you so, so much. I have to admit, I always hate it when people say to me, "You're so brave," but I think you're really brave because
Thank you.
Being willing to come on and share your vulnerability and this hardship with us in order to help others is really admirable. So I really, really appreciate it, Chaya.
Thank you.
I hope this has been helpful for you as well.
I think talking about it it's all part of the process. And I am a very private person, so but I think that sharing and also. And I mean, fortunately, I guess my story, I think a lot of young people don't have. But for the people that do, it's important to hear that there are other people going through it.
Absolutely. Thank you, Chaya.
Thank you.
We'll be in touch. Thank you.